The historic second impeachment trial of former President Donald Trump now well underway. The debate over the constitutionality of the trial now that Trump is out of office. Plus, the first of its kind COVID-19 service site right here in San Diego County. And we continue our series, Positively San Diego, the local students using creativity to continue a long-standing tradition to honor their grandparents.
ABC 10 News at 4 starts now.
History in the making as former President Trump's second impeachment trial is now underway, and this is a live look on Capitol Hill. Thanks for joining us. I'm Steve Atkinson. Within the last hour, the Senate voted that the trial is constitutional, even as most Republicans voted against going forward with it. Nadia Romero is in Washington with the highlights from day one of the trial.
A history-making moment.
Hear ye, hear ye, hear ye.
Donald Trump is now the first president to face a Senate impeachment trial twice.
The Senate will convene as a court of impeachment
Against Donald John Trump, former president of the United States.
Trump's title, former president, front and center. House managers and Trump's team of lawyers debate if the trial itself is constitutional.
The Senate lacks jurisdiction to conduct this trial of a former president, a president no longer in office and now a private citizen.
Presidents can't commit grave offenses in their final days and escape any congressional response.
The single charge, incitement of insurrection, stems from the deadly chaos at the Capitol. A month later, barricades and troops stand guard outside as senators turn jurors, hear arguments, and watch video inside from the place they were forced to flee.
We were all witnesses.
Just like the impeachment proceedings in the House, the Senate trial is expected to be fast. House impeachment managers hope for conviction and the opportunity to ban Trump from ever seeking federal office again.
I don't think President Trump will be convicted.
Especially since it will take a two-thirds majority, 67 senators, to convict. Some Republicans say the trial is a distraction from a bigger priority, the pandemic.
How many people are going to get vaccinated because of this impeachment trial? None.
In Washington, I'm Nadia Romero.
And more than 200 people have now been charged with federal crimes in connection to the riot at the Capitol last month. At least 2 people charged claim that former President Trump is the reason for the violence. Investigators have used videos and photographs from the riot to identify participants, and in many cases, tipsters have also helped them identify people who stormed the Capitol. And we will have continued live coverage of the impeachment trial on our streaming apps. You can watch by downloading our free 10 News app on your phone or your streaming device. Also tonight, it is the first of its kind COVID-19 service site right here in San Diego County and possibly the entire nation. Palomar Health and the county are running the operation at the site of the old Palomar Hospital. Our ABC 10 News reporter Rachel Bianco explains why hospital officials call it a triple threat against the virus.
Heartbreaking images of critically ill patients hooked up to ventilators have dominated headlines since the pandemic began. For some COVID-19 patients, early treatment with antibodies can keep them out of the hospital. In San Diego County, that treatment just got easier to get. Dr. Sandeep Soni is the medical director of infectious diseases at Palomar Health.
And that was our biggest hurdle. And now that we have a dedicated space that can infuse up to 50 people a day.
That dedicated space is an infusion suite in what used to be Palomar Medical Center.
You don't want to tie up an emergency room for something where it's not really an emergency, and trying to get a positive COVID patient who's still infectious into other parts of your hospital as an outpatient is not easy to do.
High-risk or older patients who are within 10 days of their first COVID symptoms and have a doctor's referral can come here for monoclonal antibodies.
Especially if they're overweight and diabetic and they end up with severe disease.
Dr. Soni explains how the treatment stops that progression.
Basically using blood from a previous patient from a while ago and looking at what they have inside of them and trying to create in the lab a protein, an antibody that will protect against that against coronavirus.
The antibody therapy is just one service offered at the site of the old hospital. 3 floors of the parking garage are now open and ready to provide COVID-19 testing and, depending on supply, up to 2,000 vaccines a day. In Escondido, Rachel Bianco, ABC 10 News.
This is the first drive-up vaccination site in the North County. Appointments for vaccines and those tests, they must be made on the Palomar Health website. The site will eventually vaccinate between 1,400 and 2,000 people a day. This will be an appointment-based drive-through vaccination and testing site in the North County. The vaccine site will be open Tuesday through Saturday from 9 to 4 p.m. Vaccines will be given by appointment only to those who meet the eligibility requirements. We do have a link to make an appointment right now on 10news.com. And we want to give you a heads up about a change in the South Bay. The Imperial Beach Vaccine Center is on the move. It is now located at the Mar Vista High School gym, but the hours and the operation, those will remain the same. It will be open Sunday through Thursday from 9:30 a.m. to 3:30 in the afternoon. You can schedule an appointment on the county's website. Today, the Board of Supervisors voted down a motion that would move law enforcement up on the list to get vaccinated. Our ABC 10 News reporter Marie Cornell spoke with Supervisor Joel Anderson, who is disappointed with how that vote turned out.
I was shocked and disappointed to learn that law enforcement wasn't in the first tier. You know, we have firefighters, we have lifeguards. I was told, well, they give CPR, and so they got priority.
In a letter written to the Board of Supervisors, Supervisor Anderson points out law enforcement officers are routinely responding to emergency situations where individuals often require medical attention and CPR.
It didn't make sense to me that they were being treated like lesser first responders when they're all first responders.
So he's asking the Board of Supervisors to support his motion, asking county health officials to allow law enforcement officers to get vaccinated. This would include more than 4,000 police officers and sheriff's deputies. The request comes as various groups across the state are pushing to get vaccinated, from airport workers to grocery store employees and teachers. Supervisor Anderson says while he agrees teachers should get vaccinated, he believes the priority right now should be on first responders because of their risk of exposure while on the job. Adding in his letter, law enforcement officers serve high-risk populations daily in our jail system and on call in our communities. He goes on to say without vaccinations, they are putting their medical counterparts, their coworkers, their families, and themselves at risk.
Well, I think teachers are very, very important. When I call because someone's breaking into my house, I don't want a teacher showing up. I want law enforcement.
Marie Cornell, ABC 10 News.
We know that there are a lot of questions and different experiences with the vaccine rollout. Our ABC 10 News in-depth team is committed to tracking down the answers and sharing your stories. So just send us an email to tips@10news.com.
The White House is ramping up vaccine supply and putting a focus on equity. The federal government is increasing its weekly supply to states from just over 8.5 million doses to 11 million. 1 million of those doses will go directly to community health centers, at least one in every state, to start. Now, these centers mostly serve people living at or below the poverty line. Mobile clinics and retail pharmacies are also getting vaccine supply to make sure all Americans are reached. Now, as we see new variants of the coronavirus pop up around the country, doctors are raising concerns about reinfection rates as well as protection from vaccines. In South Africa, researchers found 2% of people who got COVID again were infected with a new variant. Doctors remind people that having been infected once isn't enough to prevent someone from becoming infected again. They've also found the variant from South Africa specifically may not hold up well against the vaccine.
It is less efficacious now as far as acquiring the disease, but it seems to hold up as far as getting the severe disease where you end up in the hospital.
Most doctors, including Dr. Anthony Fauci, agree that this is not enough of a reason to not get vaccinated. Both Dr. Fauci and Dr. Edgar Sanchez at Orlando Health say right now vaccines are our best defense against the variants.
It seems like getting vaccinated you may still get the virus, you may still transmit it to others, even get mild disease from it, but getting that severe disease where you end up in the hospital, even our current vaccines seem to work well against these type of variants.
Now, even after getting vaccinated, it is important to continue taking all of the precautions. Right now, many states are not tracking or looking at possible cases of reinfection. Kaiser Health News found less than a dozen states are actively monitoring for reinfection. CDC guidelines advise that states to investigate possible reinfection when someone tests positive for COVID at least 90 days after the first infection. But experts say the U.S. lacks the capacity to handle this type of genetic sequencing needed.
And happening now, this is a live look. Parents are rallying for schools in the Oceanside Unified School District to reopen. This rally started about a half an hour ago, and this comes ahead of tonight's Oceanside Unified District's school board meeting. According to tonight's meeting agenda, the board is expected to give an update on COVID-19 and on the possible reopening of schools.
Experts at the World Health Organization say coronavirus probably did not originate from a lab in China. Instead, they say it is likely the virus jumped from animal to humans. Now, the teams from the WHO say that more studies are still needed to find out specifics, but one possibility is the virus originated in bats and was passed on to another species and then passed on to humans. Experts say it's also possible that humans were exposed through the trade of frozen products.